so we are going to start with her left hip right over here, okay? We're going to bring her knee up. Okay, so this is the neutral position. We're going to go into external rotation first. So, looks like she has plenty of external rotation. We're going to go into internal rotation. And it looks like she has a lot of internal rotation. So good range over there. We're going to go into flexion. Flexion is going in this position. She has very good flexion. Hey, something to actually bring up. Did you say you were hypermobile?
No, but I wish I was.
You are? Okay, what did you say earlier?
Hyperlordosis is what I have.
Okay. She has hyperlordosis according to her imaging. That's just a postural note. Okay. We're going to go into extension. I'm going to have you bring this knee up.
Okay.
You're going to hold it up here with both hands. I'm going to bring this just a little bit closer. There we go. I'm going to bring this leg down. And then come a little bit closer here. There you go. Sorry. Okay. There you go. We're going to bring this down.
Bring it down?
Oh, no. Hold this up.
Okay.
And then I'm going to push down. So relax. Okay. So here, you guys can see, here's the femur, right? Here's the center point. Okay. You can see it going down. So that means she has good extension. Okay. So her flexion, extension, external rotation, internal rotation, all really good.
Also, I think this is the hip that's like good.
Okay, so
right where it should be.
So hey, that's the hip, that's good. So now we're going to check out the other side. By the way, guys, if you guys are tuning in, my name is Dr. Patrick. I'm a physical therapist in OC, California, and we are treating Casey's hip/pelvis. I'm going to have you turn around the other side.
Hello.
Okay, so we're going to start with flexion, guys. So we're going to go up.
Thank you for the likes.
Oh, yeah. I can actually tell a difference here. It's not as smooth. The other, on her other side, her hip just kind of went straight forward. This one, I'm kind of getting a little bit of resistance right here. But it's still at 100 degrees, so that's pretty good. So now we're going to look at external rotation. External rotation is pretty good, so we're going to look at internal rotation. I felt like a click, yeah. So I felt a click in her hip already, so that shows instability. That's a ton of range of motion in internal rotation. So I'm going to run a couple tests here.
Okay.
So I'm flexing her hip up, I'm adducting her hip, and then I'm pushing inward. Any pain there?
No pain.
Okay, this is called the Scour test, so no arthritis or negative for arthritis. Good. So I'm going to check out if her hips and pelvis are aligned. Here's a good question. How do you do that? Easy. We're going to do a bridge. Okay. So I'm going to have you bring both your feet up. Or, lie down.
Okay.
Just like that. And then you're going to bridge up. Come back down. So that resets everything. I'm going to have her straighten both of her legs. Okay. I'm looking at her pelvis right over here. Looking for her hip. Her hip is right over here. I'm going all the way down to her ankles now, and I'm seeing if her ankles are like aligned. So let's do that together. I'm putting my hands around her ankles. I'm going to pull just a little bit. With the angle, 1 second. So here's my thumb. This is what I'm using as kind of like my indicator. I'm putting it right on her ankle bone, right over here. Right over here. I'm pulling. This means we have a little bit of instability going on. So, hey, good thing she's at a physical therapist, and we're gonna work on that right now. Has a upslip on her right side. An upslip just means like her pelvis is higher on one side. Nothing to worry about. And then we also have scoliosis, which is in the imaging to kind of consider. Yeah. And do you notice how she said sometimes her leg is, right? That means that it changes. Like typically leg length does not change. So what this tells us is that there's some sort of muscle stabilizer that's, there's some sort of imbalance with the muscle stabilizers there that are sometimes making it so she feels like she has a leg length discrepancy, and sometimes she doesn't. So before we go into treatment, we're going to check out her musculature through a manual muscle test. So Casey, I'm going to have you sit up. And then we are going to check her hip flexors first, okay? So I'm going to have her bring her knee up to my hand. Go ahead and do that right now, okay? And come back down. So let's reset that, okay? I'm going to ask her to put both her hands to her side. There we go. You're going to do your best not to lean back, okay, Casey? Okay. Bring your knee up to my hand. Okay? Don't let me bring you down, okay?
I feel a pull in my back for some reason.
Check that out. She feels a pull in her back. So this is a hip manual muscle test. That means we're testing the strength of her hip. Instead of feeling it in her hip, she's feeling it in her back. What does that mean? That basically indicates that instead of using her hip muscle, she's using her back muscle, and she's compensating. So anything quad muscle. Okay, you're gonna lift up again. Okay, you're going to bring your leg down all the way. You won't crush my hand. Okay, bring your leg to my hand. Okay, bend just a little bit. Hold right there. Don't let me move you, okay?
Okay.
I'm going to push down. Perfect. Any issues?
No, not really.
Look at that. No issues at all, and relax. Okay, that is a strong muscle. And then where did you feel that, Casey?
I felt that in my quad.
She felt that in her quad. That's exactly what we're expecting. So we're going to check her other side. So if you guys are just tuning in, so far we have a discrepancy in her right hip flexor. Instead of feeling it in her right hip, she's feeling it in her back. Now we're going to check her quad on her other side. So lift up. Come back down. You're going to extend. You're going to hold right here. Don't let me move you, okay? And dang, she is strong. Any issues there? No. Okay, so strong quad, perfect. We're going to check out her external and her internal hip rotators. So this leg is going to bend. Okay. We're going to go this way. Sorry, relax. This way. Hold right there. That's the motion. Don't let me move you.
Oh, that's hard.
Okay, so it's hard. Any pain there?
No pain, no, but I felt it in my hip.
Okay, so the location is correct. That's where she is supposed to feel it. It's just hard. So what does that indicate? That indicates weakness. So no big deal. We're going to try the other side. Hold right there. Okay. Don't let me move you, okay? Okay, any issues there?
Oh my guys.
What's your guys' favorite song? Anyone? Any new songs? It is 2023. I thought my music was new, but I realized a lot of it is from like 2014. Okay, we're gonna bend here. Bend there. Okay. We're gonna bring this in here, out here. Hold right there for me. Okay. Don't let me move you. Okay. Any issues there?
So I didn't feel any pain, but it's a lot harder for me to not to resist that, basically.
Okay, so no pain. What about location, Casey? Where did you feel that?
I felt that in my hip.
Okay, so location is correct. So only issue there is just weakness in external rotation. So we're going to go into internal rotation. Hold right there. Don't let me move you.
I can't.
She can barely even hold that.
Yeah.
Relax. I'm not even, I like barely even touched that. It was just her getting into that position. So we're kind of getting a couple of clues here, right? So relax. Relax. Her hip flexor is super weak that she's compensating with her back. Her hip internal rotator is also super weak. Her external rotator, it has mild weakness in it. Summary is, we still have to test her hip extensors, but it looks like her entire right hip not only has an imbalance, but it also has a weakness. Also has weakness. The question here is the weakness linked with the instability? I don't know. Let's find out. Okay. We're gonna now test out her hip extensors. I'm gonna have you stand up. Okay. Okay. So we're gonna do a manual muscle test for her glute muscles. So let's go maybe this angle. Okay, so go ahead and unload your body.
I'm doing it right here?
Yep. So, check. You're gonna like literally like unload.
Got it.
Like that. Yeah, okay. Is that too tall? I'm gonna lower just a little. Okay, bend your knees. There you go. Okay. You're gonna put all your weight on your left leg. Okay, and we're gonna take this leg. We're gonna push it out here. So relax. Hold right there for me. Okay, hold it. Don't let me move you, okay? And relax. Any issues there?
No.
Okay. So no issues with her right side. We're going to check out her left side. Okay, you're going to hold right here. Okay. Don't let me move you, okay? Okay, and relax. Any issues there?
No.
Okay. Go ahead and relax completely. Okay. And then now we're going to test a couple other things, okay? We're going to have you stand right there, Kathleen, Casey. Summarize, guys. So, or sorry, one more thing. We're going to test a couple more things. Casey, I want you to go ahead and stand on one side. Doesn't matter what side. We're going to test her balance. Okay, guys? We are looking from her belly button, her nose to belly button, and we're also looking at her belt line. We're trying to see, is there any instability? Do those lines break at all? And so far, hey, it looks pretty darn good. We're going to check her other side. Go ahead and switch. Do you see how her pelvis actually dips a little bit there? And she kind of has a little bit of a harder time. Interesting, right? Like, why would she have a harder time standing on that side? It's very possible that all of these things are linked. Hey guys, welcome to the show. My name is Dr. Patrick. We are going over pelvic health. And check it out. You can see Casey's belt line basically drop in this angle. Can you see that?
Yeah.
Okay, so we're going to summarize everything. So we went over Casey's evaluation and assessments, and we went over her range of motion. We went over her strength, and we went over her balance. Let's summarize a couple things, okay? So, range of motion wise, what was important was that her right hip was more stiff, right? Like, what's going on there? In addition, her right internal rotation was like, wow, super hyperlax, hypermobility. Like, she has a ton of range there. So something to kind of mention here is that when you have a lot of range of motion, you need to have a lot of stability. If you don't have stability when you have a ton of range of motion, you essentially get instability, which then results in some sort of like pain. So let's go into strength. Her strength issues are basically her entire right hip, right? When she goes into right hip flexion, she compensates with her back. When she goes into right internal rotation, she can barely even keep her leg up there. That's actually pretty abnormal. Let's fix that. And then her right external rotator hip part is just like normal weak. So put them all together. If you think about it, when she's walking and she's weight bearing every time, she can have some issues. So Casey, have you ever noticed like when you're hiking or doing something strenuous, like one side just feels like off, or like,
so
how would you describe that?
It's funny you asked that actually. So I was doing some walking today, and over the last couple weeks I've been noticing like a popping. in my hips, and I'm getting adjusted twice a week. So I'm also getting adjusted, and after the adjustments, I started to feel like this popping and kind of like tightness in my hip area. I can't really pinpoint what area it's coming from, but it feels unstable.
Gotcha.
It does. Yeah.
So if you kind of think about the words that I've been using, right? She has weakness, she has instability. It's pairing up with her subjective history. And so when we pair them all up, it's kind of like leading all to these impairments. Like, what do we have to do? We have to treat the instability, right? We have to treat the range of motion issue, we have to treat range of motion by teaching her how to use her muscles within the proper range. You don't want to go into the hypermobility range, right? And then we also want to strengthen all of the weak muscles. So that includes her hip flexors, external and internal rotators. Surprisingly, her hip extensors, her butt muscle, super good. Actually, that makes a ton of sense. She's been taking like a butt exercise class, right?
Yeah. It's I do strength training, and they have a booty day.
Hey, so shout out. So out of her entire hip, her butt is not weak. It's just everything else.
Woo, I'll take that.
Okay, a couple of treatments and what Casey needs to do.